I brought a study from 2015 that shows the evolution of the paradigm and the actual changes in bruxism. And this study is already over 10 years old, and in it, bruxism had already been classified. The definition of bruxism had already been changed, and in addition, the etiology, the diagnostic perspective on bruxism, and fundamentally, I want to bring you this statement. Occlusal appliances, whether on the maxillary or mandibular arch, so upper or lower splints, to remove occlusal interferences, protect dental surfaces, and relax the masticatory muscles, have been widely used in clinical practice. However, their exact mechanisms of action are still under debate, and there is no scientific evidence supporting their role in stopping sleep bruxism. This is already common knowledge in science. Occlusal splints do not play a role in stopping sleep bruxism, period. Furthermore, the lack of randomized, controlled, and well-designed clinical trials and long-term studies in the literature complicates the assessment of the effectiveness of occlusal splints. Most studies have reported a decrease in bruxism activity during the first 2 weeks of splint treatment, regardless of the device's design. However, its effect appears to be temporary and highly variable among patients, such as in many cases. Additionally, approximately 20% of patients show an increase in electromyographic activity during sleep. That is, electromyography measures muscle activity when using occlusal devices, specifically the soft mouthguard type made of silicone. So be careful, dentist, about basing your treatment solely on a splint that lacks scientific backing, that does not have support to be considered a treatment for bruxism, but rather something protective. We need to understand that there is a right time for the splint, the right type of splint, but there is an entire treatment surrounding it, and the splint is just one of the supports in this treatment. Not every bruxism patient will receive a Michigan splint, a flat splint for the upper region, the maxilla. We don't even call it a muscle relaxing splint anymore. That name has already been discarded precisely because the splint does not relax the muscles. And that's why the term muscle relaxing splint is no longer used. If you want to know more about this topic, like and share this video with more dentists.